because I think, the fact that some patients do not get adjuvant treatment is patient-driven as well. Some patients, they have adequate performance status, adequate organ function, but patients also don't want to get chemotherapy, as you alluded to. But there's also patients we see who had 0 pathological response. They come in, they have 6 positive lymph nodes.
Those are better.
Still recovering from toxicities. What do we do?
It's a really tough one. It happens more often than we think. I mean, if you look at the study, right, it happened 20-30% of the time where you had inadequate pathological response. So I don't know. Let's go around the room. That's a very good topic. Someone that gets FLOT Durva times 2 months, goes to the operating room, has 8 positive lymph nodes, and what the pathologist is telling you is not a great pathological response.
I guess at that question, what do you do differently? What's better than DFLOT at this point? I just continue it, and I counsel the patient, this is very high risk to come back. We'll keep a close eye on you, but I don't know what to do differently at this point.
I asked myself, is this a patient who got the 4 cycles before, or I got all the cycles before? That's even worse. If you got 8 cycles and you have that, that's someone who has aggressive tumor biology, poor prognosis. This is counseling to tell them that we likely will need a next line of therapy in the near future.
Yeah. Since we don't have any other strategy that would be informed or level 1 evidence, I do continue with FLOT and Durva. But I am always conflicted about it because if they didn't have any response to the chemotherapy in the surgical specimen, that is very concerning. And I think it's biology, it's not necessarily that the treatment is not effective. I mean, just their own biology.
Yeah, and there was a randomized trial, right? A European randomized trial, the VESTIGE trial, that randomized patients with exactly this scenario. It wasn't DFLOT, it was FLOT, to either continue in FLOT or Ipi-Nivo, with the idea that, okay, maybe we'll mix it up somehow. And the people who got FLOT did better. So the right answer, right, I think, as unsatisfying as it is to do more FLOT. I think... DFLOT, yeah, to do more DFLOT because, it's like doing Ipi-Nivo is wrong, and there's no evidence that any switch maintenance chemotherapy approaches are going to help these people. Nataliya, if you had your ideal study, though,